Self-drying, gowning, and gloving. This technique for drying and donning the sterile gown and gloves is always used by the first person to enter the sterile field. Others entering the field later may also use this method if a sterile team member is not available to assist. Enter the operating room without using your hands or arms to open the door. Your arms should be outstretched and away from your scrubs. Your hands should not be raised higher than your shoulders. You will maintain this basic position until your gown is donned. Use caution to maintain the integrity of the sterile field as you approach the sterile area containing your gown and gloves. Stop at least 12 inches from the sterile field. Stooping down, reach forward slowly with one arm while keeping your elbows bent and pinching the towel in the center. Slowly lift the folded towel 12 inches from the sterile field without dripping on or touching the gown, gloves, or wrapper. Step at least 12 inches away from the sterile area. Use both hands to unfold the towel. Do not allow the edges to fall below your waist. Place the lateral edge of the towel in the palm of one hand as the distal edge of the towel extends away from you. The remaining length of the towel will drop between your hands. With the towel resting in your palm, dry the opposite extremity starting with the fingers and moving circumferentially toward the elbow using a patting motion. As the towel approaches the elbow, bend slightly at the waist to avoid contamination of the towel on your scrub attire. Be sure that each area is dry before moving the towel proximally because you cannot return to a distal area. Transfer the towel to the opposite hand by reaching under the dry end of the towel with the palm of your dry hand. Do not cross your hands or pass the wet edge of the towel over your scrubbed hands. Dry your opposite hand and arm moving from distal to proximal using the same technique used to dry the first arm. Discard the towel into the proper receptacle. Do not wad the towel or place it in your other hand. Approach the sterile field, maintain a 12-inch distance, and secure the gown by grasping it at the center near the neck. Do not touch the gloves or the wrapper. Lift the gown 12 inches up from the wrapper and step back at least 12 inches. The gown should remain folded. Reposition the gown so that you are touching the inside of the gown near the shoulders. The neck of the gown should be oriented to your neck. Allow the gown to gently unfold. Begin to don the gown by slipping your hands into the folds that lead to the sleeves. Slide the gown over one arm into the shoulder using a swimming motion. Your hand must remain within the sleeve of the gown. Twist the arm already in the sleeve to hold the gown in place and slide the gown sleeve over the opposite arm in the shoulder, again using the swimming motion. Your hand must remain within the sleeve of the gown. The circulator will assist with the final gown adjustments and fasten the neck and back of the gown while you prepare to don your gloves. Curl your middle, ring, and pinky fingers inside the sleeve of the gown. Position the thumb and index fingers of each hand at the junction of the sleeve and cuff so that they can be used to pinch. Orient the glove wrapper so that the right glove is on your right side. And partially open the glove wrapper to expose the first glove. Use caution to ensure that the floppy cuffs of the gown remain well within the sterile area. It does not matter which glove is donned first. The individual demonstrating gloving is left-handed and prefers to glove her dominant hand first. Pinch the cuff of the glove with the opposite hand and flip it over onto your palm. The glove is aligned on the palm of the hand with the thumb side of the glove toward your palm and the fingertips toward your elbow. Pinch the folded edge of the glove cuff with both hands, one hand pinching the top and one hand pinching the bottom. Keep your hands above the level of the sterile field and below your mid-chest level. Pull the cuff of the glove over the cuff of the gown so that the cuff of the gown is covered, but do not pull the glove onto the sleeve. Inspect the cuff of the gown to ensure it is completely covered by the glove. Unfold the cuff of the glove onto the gown sleeve, but do not pull it toward the elbow. Grasp the glove and the gown at the wrist level and gently pull toward your elbow. Work your fingers into the glove as you pull the glove into position. Secure the second glove and apply it using the same technique. You now have an advantage because you can use your gloved hand normally. Make any final adjustments. Prepare to wrap around the back of the gown by asking the circulator to assist you. Slide the thumbs of your gloved hands down the front of your gown to locate the attached tag and string. You should be able to locate the tag and string combination without visualizing it. Grasp the tag in your right hand and the gown tie in your left hand. Separate the tag from the string by pulling your hands laterally. Hold the string so that it does not drop below the lowest sterile level. Straighten the tag if necessary. Hold the tag near the attached string to allow the circulator maximum space to grasp the tag. Most tags include a graphic that delineates the area that can be touched by the sterile and non-sterile team members. Turn slightly to your right and pass the tag to the circulator at your right side. Be sure to observe the transfer so that if a breach of sterile technique occurs, it is identified and corrected immediately. Do not turn your back on the sterile field. The circulator will move behind you, wrapping around the back of the gown. Turn slightly to your left to accept the gown tie from the circulator with your right hand. Grasp the end of the gown tie and tug it gently so that it separates from the tag being held firmly by the circulator. The circulator will discard the tag. Secure both gown ties with a bow. As soon as your gown is tied, you may approach the back table and don your second pair of gloves, using any technique that is convenient. The gown and gloves are considered sterile in the front from the waist or table level to the mid-chest line. The hands and arms are considered sterile circumferentially to 2 inches above the elbow. The area described is considered the sterile zone.